Good morning, everyone. I'm Amalia from China Medical University. Today, I would like to present a study about the effect of therapeutic aquatic exercise on dynamic balance in subacute and chronic stroke patients. It's a systematic review. We know that stroke is the neurological disorder characteristic by blockage of blood vessel and divided to hemorrhagic and ischemic stroke. And there are three levels of stage of stroke. There are acute, subacute, and chronic stroke. And we know that most stroke have several problems in motor impairment, sensory impairment, cognitive function, which can affect to quality of life. Balance impairment. Balance is the ability to maintain the line of gravity within the base of support with minimal postural sway. First says about the human balance control is a comprehensive process relying on the integration of visual, vestibular, and somatosensory input to the central nervous system. And Khan in 2021 reports that 60.7% to as high as 83% of balance impairment has reported. And we know that many rehabilitation programs of balance impairment, and the study will focus on the aquatic exercise or hydrotherapy. This is the mechanism of hydrodynamic influences and the somatosensory system, which is the hydrodynamic principle in water property, and which can affect it so somatosensory input, motor output, and the effect and other effects. Aquatic exercise have some various techniques. There are IT, aquatic treadmill, hollowick, and better gathering methods. IT is the combination of IT and Qigong concept, and the movement is a slow and coordinated rhythm. And for the aquatic treadmill, we can see in the figure. And the next one for the hollowick concept, we can see the movement in this figure. And the last one for the better gathering methods or BRM. So for the purpose of this study is to analyze effectiveness of aquatic therapy on dynamic balance, which is compared to the control group in subacute and chronic stroke patients. For the protocol and registration number, this study followed this PRESMA statement, and with this registration number in Prospero. For the search strategy, we collect from the three database, PubMed, Pedro, and Channel with this term. And the eligibility criteria for the inclusion and exclusion, the type of participant is the stroke patient and more than 25 years old. For the intervention are the aquatic exercise, and the comparator is conventional physical therapy, and type of primary outcome is the dynamic balance, and the secondary outcome are motor function, functional ambulation, and daily living activities. And the study design are the experimental trial, both RCT and non-RCT, published in English and published here between 2014 to April 21. And the exclusion criteria for the participant are the cognitive impairment and other neurological condition. The quality assessment we conducted by the Pedro scale with this trial score, and the clinical assessment with the Breath Balance Scale or PBS, Stand Up and Go test, and functional reach test. For the data extraction, we will extract the study characteristic, participant characteristic, and the intervention. Also follow up after intervention. And for the statistical analysis and the data synthesis, we will use the R software with this detailed term. And the statistical significance was defined as p value less than 0.05. This is the results for data strategies following the Prisma flowchart. And the results of the quality assessment by Pedro is the highest score are the 8 out of 10, and the lowest score 4 out of 10. And for the characteristic study, there are type of stroke. There are 5 studies of subacute stroke, and the 14th study for the chronic stroke. And there are the detailed intervention of the subacute stroke. They have 5, and there are different techniques, which is the Holloway aquatic treadmill and the water-based exercise. And for the detailed intervention of chronic stroke, they also have different technique, and mostly they use aquatic HE. For the result in clinical measurement, 5 of subacute stroke, they use this measurement, and for the chronic stroke, we can see in this table for the clinical measurement. So therefore, we can see the meta-analysis results. It's forest plot for prevalence scale. We can see that compared to the control group, aquatic exercise shows significant improvement by medium effects. It's 76%, with the p-value equal 0.0009, and the heterogeneity and significant heterogeneity with I-square equal 75%. The heterogeneity is because different technique in the aquatic exercise. And the next one for the forest plot for the time up go and test, we can see that compared to the control group, aquatic exercise show no significant improvement by small effect size, 0.41 or 41% with the confidence interval, and the p-value equals 0.2, and have the highest heterogeneity and significant heterogeneity of study. The last one for functional reach test, there are they have heterogeneity 74%, and it's significant heterogeneity. And this meta-analysis show that compared to the control group, aquatic exercise shows significant improvement by a large effect size, 83%, and p-value equal 0.03. So for discussion, the meta-analysis from 13 study demonstrated that the BPS score a significant improvement in experimental group with this p-value, both subacute and chronic stroke. And how was the balance improvement? It might be trunk and leg weight sparing ability attributed to trunk mobility movement and lower extremity muscle strengthening exercise, while the aquatic exercise underwater, something like training underwater. And for this study finding, aquatic exercise and specific aquatic technique can treat both subacute and chronic stroke. And this study showed that aquatic therapy significantly improved all of the variable in balance and mobility function after intervention in both periods. And specific aquatic technique have more improvement and significant improvement in the chronic stroke is the balance with the clinical measurement balance scale and balance index. And in subacute stroke, they have knee flexor and extensor muscle strength. And for the limitation of this study, there are small sample size and small study in subacute stroke. Thank you. And thank you. Thank you. This is the end of my presentation.